go to the topic of prostate. Should men be scared of the finger?
So I would say no. The prostate exam is one that we use for screening patients for prostate cancer. There's no reason to be scared of it. I've not seen anybody die from it. I've not seen anybody converted into a homosexual because of it. I've not seen anybody jump off the bed. I've not seen anybody say, oh my God, it's the end of the world. Nobody has gotten erectile dysfunction from it. So there is absolutely no risk to having a prostate examination done. And this is what we need to encourage persons, that there is absolutely no risk to getting it done, and it is rather quick. All right. That being said, you're still going to have persons who are afraid of prostate exams. Now, for that group of persons, I would say don't use it as an opportunity to not go to the doctor. You can still go to the doctor and have a PSA blood test done. Right? The recommendation is that you do both the PSA blood test and the prostate exam. However, if you are unwilling to have the prostate exam, do not stay away. Get the PSA test done, because it may give you some information about your risk for having prostate cancer. For the person who doesn't want to have either of them done, you are going to need some more counseling and more work, because it is important.
Do you think enough Jamaican men are coming in to get their prostate test done?
I would still say no. We're in 2023 now, and we're still having persons who are seeing with advanced prostate cancer. And if we're still seeing patients with advanced prostate cancer, it still means that the message is still not getting through to a lot of men. And I think that remains a significant problem for us as a country. The fact that we see persons with advanced prostate cancer, they had an opportunity to get screened starting at age 40. Now, PSA testing and all the major things about prostate cancer screening really came about, I would say, more so mainstream about 25 to 30 years ago. So I can understand, somewhat, somebody coming in 74, 75, and they weren't aware of it before. But what has happened over time is that we should have tried to make people aware. So even if it didn't start at 40, it could have started at 50, it could have started at 60. So really there's no excuse, right? Because the message that we are trying to deliver should have gotten through. And I think is the message that we need to push.
Are there signs that men can look out for as it relates to prostate?
So the myth about prostate cancer having signs or symptoms lies within the fact that early prostate cancer usually doesn't have any signs or symptoms. And what we need to make people aware of is that there are no really signs if there's signs or symptoms of early prostate cancer. If you're starting to have signs and symptoms, it may be a sign that it may be late prostate cancer, or it may not even be prostate cancer. It may be just an enlarged prostate that is different from prostate cancer. So we have to make that distinction, and we have to stop, telling people, oh, if you have a sign of this, you should go and get checked for prostate cancer. No, you should go and get checked. It's not necessarily for prostate cancer only, because there are other things that you need to be aware of. All right, and there's no reason to be afraid. The narrative should be screening for prostate cancer or getting checked for prostate cancer is done whether you have symptoms, yes or no. And the earlier you do it, is the better for you.